Now, the thing is that you're dealing with arteries are dealing with pressure and force, but what if your arteries weren't as elastic? And what we have here?
Did it! I want to land it.
Yeah, I don't have the material or saran wrap to simulate that. That's why I use that clip. But saran wrap holds up pretty well if you apply enough layers, but it doesn't have the elasticity of that previous trampoline and all the springs, right? So what happens if you have a lot of these strong layers, but they don't flex? Well, if you have constantly bombarded with pressure and they don't flex, eventually it's going to start wearing away at that material. So what if your arteries couldn't handle the pressure and they weren't elastic? Well, it could result in something called an aneurysm. And this is an artery enlargement due to a weakness in the arterial wall. Just like in that previous clip, what we saw is that the kid was like pounding on the same area over and over again until it tore a hole or it starts thinning and breaking down that layer, and eventually he burst through, right? So yeah, this is an example of what aneurysm, or a figure that shows what aneurysm looks like. So what we have here, if a little spot in the artery gets weakened, then it can balloon out due to all the pressure that arteries experience. So it's not like it started off like this, but due to some weakening and pressure continually stretching that area, that can result with the aneurysm. And yes, I think someone's getting to one of the causes of aneurysms. So the good thing about that is that or actually I shouldn't say good. So the thing about aneurysms, well, these are intact. You don't have hemorrhaging yet, so they are asymptomatic because as long as the thing is that the blood is still going to circulate through these arteries, but you don't have hemorrhages yet. You don't have all the health effects and the symptoms from the hemorrhage because their blood is still within the closed circulatory system. But what if it bursts through, just like that kid burst through that saran wrap trampoline? Well, now you have hemorrhage. Now you have that internal bleeding. And what does that do to the surrounding tissue? Well, now you have all this fluid from the blood accumulating in the tissue. It's going to cause the tissue to swell up, thereby increasing the pressure in that tissue. And this is why, if it happens in your brain, this is why it happens. And I don't know anyone who has had this, but looking through accounts of people who have had aneurysms and the literature, they say it's like the worst headache you've ever had by far. And so they say that's their main symptoms. But now what's happening here? Well, they've probably had that aneurysm for a while. It's just that it just happened to rupture at that moment. And this is why often these aneurysms are very sudden and they strike without warning, because they could have had this for years. And this only happened last year. I think actually before I presented this lecture, this literally happened like a few days before that lecture. So this politician, yeah, they found him dead in his car, and he was, I know for some of you, you're like, anybody over 30 is ancient, but he was only 41. And yeah, so it was tragic. They found him dead due to a brain aneurysm. Yeah, so it's like crazy. And actually this is just this year, Dr. Dre, and I know this is probably like not your generation and actually hasn't released anything recently, but yeah, he's one of the especially if your parents probably know about him, especially during the 90s, like late 80s and 90s. That was his peak, and one of the first one of the leaders in that. So Dr. Dre had a brain aneurysm, and I think he's recovering now. Yeah, but there was more about that. But aneurysms, they strike without warning because, again, and they can occur anywhere, but some spots are more frequent than others. The more common is a cerebral aneurysm. So cerebrum referring to your brain, and this is why this is often deadly. The thing is, like, if you have this aneurysm in your brain, but it's not ruptured yet, then all of a sudden it ruptures, then what's it going to do? It's going to swell up the tissues of your brain, thereby constricting any other blood vessels, and also causing pressure on the cells of your brain, causing them to either get damaged or more frequently die. So this is why this is the most deadly, because if someone tries to walk off of a brain aneurysm and the brain continues to swell with blood, then that's going to result in death of the tissues of the brain. So we did talk about cerebrovascular accident in terms of like a stroke, but we talked about now stroke is a more general term referring to impaired blood flow. But what we had talked about previously when we talked about clot forming in the brain and causing ischemia, that's ischemic stroke. So when you have a clot blockage in a vessel that leads to the brain, but now it's going to starve the brain by blocking the blood flow. Hemorrhagic stroke is a different type. So instead of like blockage in a blood vessel leading to the brain, it's actually due to a rupture of a blood vessel. It's not a blockage. So hemorrhagic stroke, sometimes called brain bleeds or a cerebral hemorrhage, is another medical term for it, and is caused most frequently by a ruptured aneurysm. So what happens? Blood leaks out from a blood vessel supplying the brain. That causes increased fluid and pressure in the brain from all the fluid building up. And by all that pressure, cutting off the circulation of more blood vessels and also applying the pressure directly to the cells of the brain and the neurons, that results in cell damage and death in the brain. So this is why cerebral aneurysms are very deadly, and hemorrhagic stroke is that's why we see that high percentage of death. Now again, it's different from ischemic stroke, and ischemic stroke is the majority of stroke cases. So again, ischemic stroke is caused by clots. Hemorrhagic stroke is, again, aneurysms in general are relatively rare. They happen, but compared to ischemic strokes, they're not as common. And there are subtypes depending on where this bleed occurs. Does it occur in like the tissues of the brain? That's what we call intracerebral. Subdural. So hey, dura mater, where is that? Remember the meninges if you were here last semester? Yeah, so the thing is that how's the pressure released? Yeah, so the thing is that you want to release the pressure from the skull. So you want to kind of there's various interventions, but what you want to do is kind of like remove some of the blood volume so that you relieve the overall pressure in the brain. And then subarachnoid. Hey, what do you find in the subarachnoid space? Remember those three letters, CSF? So that's another thing. There's other types of hemorrhagic stroke depending on where the bleeding is leading to.